Alright clinicians, let's talk Acyclovir. Whether you're managing patients on the floor or consulting in clinic, this antiviral is essential knowledge. Compact, effective, and a frontline agent for herpes-related infections. Let's break it down. Acyclovir is an antiviral that inhibits DNA synthesis in herpes viruses. That includes herpes simplex virus types 1 and 2, Varicella zoster virus, and to a lesser extent, Epstein-Barr. Mechanistically, it's phosphorylated by viral thymidine kinase and incorporated into viral DNA, halting replication. In simpler terms, it selectively targets infected cells, minimizing damage to healthy tissue. Let's review the key indications for IV administration. First, acute herpes simplex in immunocompromised patients. Think transplant recipients, HIV-positive individuals, or those undergoing chemotherapy. Acyclovir rapidly reduces viral load to prevent systemic spread. Second, severe genital herpes. Even in immunocompetent patients, primary or severe recurrent outbreaks may warrant IV therapy for rapid symptom control. Third, varicella zoster in immunocompromised individuals. IV acyclovir is critical to prevent complications like disseminated infection or pneumonia. Fourth, herpes zoster or shingles in immunocompetent patients with severe presentations, such as widespread rash or systemic involvement. And finally, herpes simplex encephalitis. This is a neurologic emergency. Initiate acyclovir immediately if suspected. Time is brain. Now let's talk dosing. For adults, IV acyclovir is typically dosed at 5 to 10 milligrams per kilogram every 8 hours, depending on the clinical scenario. Use ideal body weight in obese patients and adjust for renal function, since acyclovir is renally excreted. Hydration is essential. Crystalluria can lead to nephrotoxicity if not properly managed. Ensure adequate fluid intake and monitor renal function, especially creatinine levels, throughout treatment. Side effects? Common ones include nausea and headache. But with IV use, be vigilant for renal impairment, neurotoxicity, such as confusion or tremors, and phlebitis at the infusion site. Oral acyclovir is also available, though it has lower bioavailability. It's often used for step-down therapy once the patient is clinically stable. In summary, acyclovir remains a cornerstone in the management of serious herpes virus infections. Know the indications, understand the dosing, and monitor for adverse effects. It's a critical tool in your therapeutic arsenal. That wraps up your concise clinical review of acyclovir. Stay sharp out there, and see you in the next update.
Remember to subscribe, and don't forget to hit the bell icon to never miss an update from Health Review Desk.